that's back to this idea that the incentives politically and for agencies is to avoid harm, not to advance innovation, which is going to bring some benefits.
I'll let you get to the revolving door now.
So I'm actually in some ways, represented in this, right? So I had been at FDA for a number of years. Before I was at FDA, I was at a medical device company. I was in a lower level position, and then I, had some hands-on experience with devices, and ended up going and working at FDA again at a relatively low level, position, doing reviews of, medical device, submissions. You know, Ended up in middle management when I was at FDA. Ended up in some more senior management at a company when I left FDA. They had a specific challenge that they needed some help with navigating what FDA needed for some submissions. And most of what I did at that company was actually helping them go get the testing that they needed to present to FDA, so FDA would be satisfied with what they saw, much like what we were talking about, earlier on. And you know, and then at that point, I ended up going into consulting. I've helped, some small startups, some medium-sized companies navigate FDA bureaucracy and regulations, and help them prepare for FDA to show up so that they can, do a better job of giving FDA what they need to get a positive result. And there are a lot of people like me who've served in government and now are more in the private and consulting space. The real challenge, though, this is it's a situation, though, which I think can cause a lot of consternation, among people, that you get this movement of people from industry to FDA and then from FDA to industry. It's mostly a big issue at the senior, very senior levels within FDA and senior levels at very large multinational companies. And it's most suspicious when you have somebody who's either come from industry, gone to FDA, and then goes back to the same company, or you get somebody who's been at FDA in a senior, sort of capacity, and then they are involved in making a favorable decision for some company, who shortly thereafter, ends up hiring them into some senior role, or as a consultant, paying them, very high fees to advise them. And some of that is just how the system is set up. And there are certain guardrails against that. I can link an article, that I wrote about exactly this recently, just about a week ago. I don't know when this will get published, but I wrote it before we spoke, and we can post a link to it for people to check out if they want. But fundamentally, there's a real issue here in terms of public trust when it comes to this revolving door, which I've been through, right? So I've gone from industry to FDA and FDA to industry, and there's something we really need to do about that revolving door, and some of it's making people aware of what guardrails there are against this, but it's also important to to ensure that there's not this situation where we get a monoculture developing, because you get this revolving door of people. So whenever people spend a large amount of time together, you start to build a specific culture. And we talked about this a little bit with the medical companies or drug companies, where they're very incentivized to do exactly what FDA is asking them to do. And some of that can even be driven by the fact that some very senior FDA people may now be at that company, and there's now this alignment in terms of vision and purpose that knits these companies and FDA together in terms of what direction is being forged, and I think that can be that can present certain dangers because we're likely to miss things. We're likely to just settle in on status quo or settle in on a particular tribal way of seeing things because FDA and the drug companies tend to be fairly aligned on certain perspectives. You wouldn't be at FDA reviewing drugs. You wouldn't be at a company developing drugs unless you shared certain basic worldviews, right? Just to begin with. And then that can get further exacerbated by this revolving door and people passing back and forth. And you get, these well-worn tracks that I talked about in terms of, this is the way we're doing it. This is the way we've done it. This is how we've been successful. And there's a real inherent trap there in getting to where we need to be and making sure that we can restore public trust. Because the public is not going to be very trustful, about a system which has got this revolving door between industry and FDA, and where there's a perception, at least, that FDA is allowing all kinds of things onto the market, which, for the public, may in some cases be hazardous, and that's back to this idea that the incentives politically and for agencies is to avoid harm, not to advance innovation, which is going to bring some benefits.